Good afternoon everyone. Myself Dr. Smrutika Shinde. I am as an assistant professor in Dr. Patil College of Physiotherapy. So today we are going to start with a new topic, and that is neuromuscular coordination. So for physiotherapists it's very necessary to know how the neurons and muscles interact for a muscle contraction. So what are things we are going to study in this today's lecture? So there are certain objectives and contents to be followed. So by the end of this lecture, all the students should know, you should know what is the meaning of neuromuscular coordination. Second is what are the components of neuromuscular coordination. Then third is what is the physiology of neuromuscular coordination. Then fourth is what is incoordination. Okay. And then next is what are the Frenkel's exercise. Then principles and techniques for the incoordination. And next is the balance exercise, and last is the whole summary. So these are the topics or the contents what we are going to study today. So first we will go for the definition of neuromuscular coordination. So what is neuromuscular coordination? So it is the coordination between nerves and the muscles. So nerves sends some impulses to the muscle and then the muscle contracts. So that is some coordination. It is also known as what? Motor control. Neuromuscular coordination relates to the ability of nervous system to efficiently recruit a muscle or group of muscles in order to perform a specific task. So if you want to perform a specific task, like if you want to lift up something or if you want to do any activity, so there should be connection between the nerves and the muscles properly. So that coordination is what called as neuromuscular coordination. So now what are the components of neuromuscular coordination? So mainly it has been divided into two types of components. So first is your intramuscular and second is your intermuscular coordination. So you can even say that there are two types of coordinations. That is what? Intramuscular and intermuscular. So now we'll see one by one what is the meaning of this. Intramuscular coordination and neuromuscular coordination, it describes the interaction in between the nervous systems and the muscles. And the intramuscular coordination defines the number of muscular fibers that can be controlled synchronously by the nervous system within a certain muscle. So intramuscular is what? The connection between the nerves and the muscles. And what is your intramuscular? It is the connection between the muscle fibers. Okay, your nerve involvement is not there. So you got it everyone, what are the components of or what are the types of neuromuscular coordination? So now we'll go to the next slide. Now this is the physiology or what are the steps taking place in the neuromuscular coordination. So first is this is your first action potential from motor neuron. So you must be knowing what is action potential. So this is here you can see the diagram. So here you will see the action potential is generated, and in the second point is what the calcium channels gets open. So there are potassium and calcium channels being present. So after the development of action potential, these channels are being opened. So what happens after opening of these channels? These calcium ions have been influxed. That has been calcium ion goes inside. That is your the third point. Fourth is what happens? Vesicles of acetylcholine releases to synaptic cleft. So in this process, whole acetylcholine is being released, and this is your first step. The fourth step. Fifth is your after the release of acetylcholine, it binds to the sodium channels on the muscle membrane. So here is your fifth point you can see. So here what happens when the acetylcholine is being released? What happens? Your sodium channels on the muscle membrane, it gets attached to the sodium. Okay, and last what happens? There is an influx of the sodium. So sodium gets influxed. So here is the sixth diagram you can see. Sodium gets influxed. And last is what your 7 point, depolarization of muscle cell or the excitable membrane. And then what happens? There is the depolarization. This is your 7 point. Depolarization occurs and the membrane cell to the excitable to the membrane. So this is what the whole physiology. So these are the certain steps which takes place at the cellular level to produce the neuromuscular coordination. of the motor junction. Okay, this is the nerve, and you can see this the whole thing is your muscle. Okay, these the red ones are your capillaries, and this is the case of the muscle. You can see the inner parts of the muscle, mitochondria or myofibrils. So here you can see how the nerve has been connected to the muscle. Here is your the synaptic vessels. You can see the synaptic vessels which are present in the this one nerve terminal. Okay, so this is what called as your neuromuscular junction. Now these are the chemical changes what occurs during the neuromuscular coordination at the neuromuscular junction. So here what happens? The neuromuscular junction is a specialized synapse. So that serves to transmit the electrical impulses. That is what your action potential has been generated from the motor neuron nerve terminal to the skeletal muscles. So basically the neuromuscular junction allows for efficient and reliable communication between the motor neuron nerve and the muscles required for contraction and the movement. So the primary chemical messenger in the synapse, which consists of the presynaptic region, so this is containing of the nerve terminal, the synaptic cleft and the postsynaptic surfaces is acetylcholine. So in this diagram you can see how has been acetylcholine released. There is influx of calcium ions, there is opening of the calcium gated channels, there is influx of calcium ions, and again see here you can see this part. Okay, so here you can see again there is potassium and sodium channels have been present here. So there is also influx and efflux of this potassium and sodium channels. So these are all the chemical processes occurring at the neuromuscular junction to produce the neuromuscular coordination. So this is what happens at the cellular level. So what this is the physiology of the neuromuscular coordination, that is how and what happens and what are the steps being carried out to bring out the coordination. So now there is a simple example. You can see a diagram over here. Like there is one girl who is sitting over here, and we are just tapping on the patella. Okay. So now the first step is what here? Striking the patellar tendon causes the muscle to extend slightly. So whenever you will tap here, what will happen? The leg will go into the extension. So what happens actually in this? So first what happens? The first thing is stretch receptors in the muscles are stimulated. So there are some stretch receptors which are present in the muscle whenever you give a stimulus by the hammer. So these stretch receptors are getting stimulated. Then they transmit the sensory impulses to the spinal cord. So this sensory impulses are being carried out to the spinal cord. So then next what happens? This is the second stage. So now you will see the third stage. So whatever impulses are being carried out, so this is being passed back to the motor neuron. So from the spinal cord it goes to the motor neuron. And again, then what happens? If you go to the fourth stage, so here what you will see, motor neurons travel back again to the muscle. And whatever response you want, that is been achieved. So what you will get? The extension of the knee you will get. So see, motor neurons travel back to the muscle and stimulates the contraction. So this is a simple example of neuromuscular coordination. That is what, like how you will see the response. When you will give a particular stimulus, you will see some response by some neuromuscular various steps will occur in all these things, and you will get the response. Okay. So now next is we'll see. So this was about all the first introductory part about the neuromuscular coordination, like how the nerves and how the muscles are being connected to each other. What are the components of the neuromuscular coordination? What are the types? And what is the physiology of this neuromuscular coordination? And what happens at the cellular level? Or what are the chemicals responsible to carry out this coordination? So now we'll see what is incoordination. Okay. So now this is required for a physiotherapist. So what is incoordination? What is balance, and all that we'll see. So now first we'll go to the definition. See, interference with the function of any one of the factors which contribute to the production of coordinated movements will result in jerky, arrhythmic or inaccurate movement, which is said to be incoordinated as the harmonious working together of the muscle is disturbed. So anything which is not being coordinated. Suppose if you are lifting something, like lifting a pen or a bottle and all, so you will see that the patient will do some jerky movements, or he'll do some shivering, or he'll not be able to do the accurate movement. So that is what called as what? Incoordination. So the type of incoordination and the exercises designed to help in overcoming it vary according to the location of the lesions which causes it. Okay. Now we'll see what are the four main types usually benefit from the suitable exercise therapy. So in which conditions is this incoordination affected? So what are all the disorders or diseases where it is being affected, that we'll see. So now the first here you will go, first is this one. So in this we'll see incoordination associated with weakness. Okay, weakness or flaccidity is very important. So if there is any lower motor neuron lesion, okay, so see here in this case either some lesions of the lower motor neuron prevents the appropriate impulses from reaching the muscles, or the condition of muscles modifies their normal reaction to this impulses. So what happens if there is a patient of stroke or any low motor neuron lesion, like Bell's palsy somewhere, so or any other examples you can take. So there are many conditions where you can see the incoordination is affected. So this is the first cause. Now second cause what you will see, that is what? Spasticity, which is totally opposite of the flaccidity. Okay, so what is spasticity? Spasticity is nothing but there is increase in tone. So anyone can tell what is the meaning of spasticity, what is the meaning of flaccidity, or where you can see all this. So see, incoordination associated with spasticity of the muscles, lesions affecting the motor area of the cerebral cortex or the upper motor neurons result in spasticity of the muscle. So whenever there is any type of lesion to the upper motor neuron lesion, you will see spasticity in the muscles. That is what? There is increase in muscle tone. So therefore, even when some appropriate impulses are able to reach them, the condition of muscles is such that the response to them is abnormal. So what response, whatever you will get, so that will be abnormal. Patient will not be able to lift the elbow properly, so because of the increase in hypotonicity or spasticity. Okay, so in such conditions what will happen? You can see incoordination. So first was your flaccidity, second was the spasticity. Now what is the third cause, or what is the third example we will see where you can see the incoordination. So now see, incoordination resulting from cerebral lesions. Okay, so what is this cerebral lesions? So whenever there is any lesion to the cerebellum, that will definitely lead or land up into incoordination. So this is generally known as cerebral ataxia. The prefix a meaning without and the Greek word taxis means order. So there is marked hypotonicity of the muscles which tire easily and inadequate fixator action not only of the muscles directly concerned with the group action but of the body generally. So movement is irregular, swaying with a marked intention tremor. So what is cerebral ataxia? So in this what happens? Patient is not able to walk properly. He is not able to judge. So where is the floor or where I am walking? He keeps swaying to the right and left. Okay. So in such conditions, this incoordination has been affected. So this was your third reason or the cause. And now the fourth we'll see, that is what? Kinesthetic sensation. Okay. So what is this? Incoordination resulting from the loss of kinesthetic sensation, sensory ataxia, or in the case of, so these are some conditions like H. dorsalis or hepatic ataxia. So in these conditions you can see this incoordination has been affected. So now let's see. So you got it. So what up till now we have studied what? First, what is the neuromuscular coordination? Then what is being neuromuscular junction? What are the chemical processes or the physiology of the neuromuscular coordination? Then next we have studied the abnormal, that is what is incoordination. Incoordination. Then next we have studied what are the four causes or where does this incoordination gets affected. Okay. So anyone is having doubt up till now? If no, then we can proceed ahead. Okay, so now next part we'll see. So what are the Frenkel's exercise? So see, this is the most important part for physiotherapists to know. What is this Frenkel's exercise? Very, very important. So Frenkel was one of the medical superintendent. He was one of the superintendent of Santorio. Okay, he was from Switzerland. So he has found out this exercise. So mostly this exercise, where it is been used, it is being used in incoordination patients. So now see, he made special studies of Patel's dorsalis and devised a method of treating the ataxia, which is a prominent symptom of the disease. So by means of systemic and graduated exercises. So he has found out this exercises and he has been studied. He has done a research on these exercises in the Patel's dorsalis conditions or in such patients. Okay. Now these are the principles of Frenkel's exercise. So what are there are main three principles of Frenkel's exercise. So first here you will see that is the concentration, okay, of the attention. Second is precision, and third is the repetition. Okay. So there are main three principles of the Frenkel's exercise. So now what is the meaning of this concentration? Whenever you are prescribing any exercise, any Frenkel's exercise to the patient, you should ask the patient to concentrate, or you have to pay attention what you are performing. Okay. Second is precision, and third is your repetition. Repetition means what you have to ask to repeat it frequently. Okay. Now we'll see the next part is what the technique. So how you will perform and what are the commands you will give to the patient. So now see, first is you have to see for the comfort of the patient, you have to see for the restful atmosphere, proper comfort of the therapist, everything you have to give your orientation to the patient, and then you have to tell what procedure you have to do or what are the exercise to be followed, what the patient has to do. So now see, the patient is positioned suitably close so that he can see the limbs throughout the exercise. Very, very important thing. First thing what you have to do is you should ask the patient to expose the part, whatever, like hand, limb, wherever exercise you are going to give. Why? Because the movement should be visible to the patient. So the first technique is what? Patient is positioned suitably and close so that he can see the limb throughout the exercise. Second part, second technique, a conscious explanation and demonstration of the exercise is given before movement is attempted to give the patient a clear mental picture of it. Okay. So first you have to explain properly to the patient what exercises to be carried out. Okay. Even if some of the patients will not understand, then you have to demonstrate on them, like what exercise or where you have to keep your leg, how you are going to perform the exercise. So before performing or actually starting, you can demonstrate. So the third technique is patient must give his full attention to perform of the exercise to make the movement smooth and accurate. So here comes your first principle, that is the attention. So what is there? The patient must give his full attention to the performance of the exercise to make the movement smooth and accurate. So the patient has to pay attention whatever he is doing. Okay, he should not chit chat with the relatives. He should not have a phone in his hand. Okay, he should fully keep attending and he should perform properly. Now the fourth is the speed of the movement. The speed of the movement is dictated by the physiotherapist by means of rhythmic counting, movement of her hand, or the use of suitable music. Okay, wherever assistance is required, you can give. And the speed of the movement is been dependent on the patient. How much patient is able to do that, you have to explain or you have to perform. And next, the fifth technique is range of movement. Okay, so it is indicated by marking the spot on which the foot or hand is to be placed. So this part I will explain you in the next slide what we have to actually do. So here you have to mark a spot, you have to draw a diagram, or you have to mark a spot in the wall or on the floor, and you have to just ask to jump on that, or you have to draw a line on the floor, and you have to ask to walk on the line. Okay. Now the sixth technique is the exercise must be repeated many times until it is perfect and easy. It is then discarded and a more difficult one is substituted. whatever Frenkel's exercise you are being carried out, so that you have to repeat it. The frequency of exercise you have to increase it. And once the patient gets accommodated for this exercise, what is your main target is you have to give the next exercise. That is what the more difficult exercise should be substituted by the previous one. Okay. So now the 7th point or the 7th technique is, as these exercises are very tiring and fast, frequent rest periods must be allowed. So initially what happens? The first exercises patient goes in difficult to perform. So you have to give some rest period in between your exercises. Okay. The patient retains little or no ability to recognize fatigue, but it is usually indicated by a deterioration in the quality of the movement or by a rise in the pulse rate. So you have to see the vitals, because Frenkel's exercise will not disturb your vital signs, but also if some of the patients whose vitals are not stable initially, so later on you have to just keep an eye on the vitals, or you should see that the patient or the muscle should not get fatigued. Okay, so for this what you have to do, you have to give some rest periods in between the exercises. So these are the techniques. Okay, so you wanted what are the 7 techniques and what are the principles. So 3 principles: concentration of attention, precision and repetition. This is very, very important for your exam. And now next we have seen the techniques. That is what there are 7 techniques. Now next we'll see the examples of Frenkel's exercises. Now actually we are going to start what are the Frenkel's exercises and how you are going to perform. So now see, first is what exercises for the legs in line. Okay, so what you will do is, in this line is what head raised, hip abduction and adduction. The leg is fully supported throughout on the smooth surface of plinth or on the re-education board. So here you have to ask the patient to just sleep, lie down, and the head should be raised. So you have to give some pillow or something, okay, some head raiser, and you have to ask to lie down. And what? Hip abduction and adduction. The leg is fully supported throughout on the smooth surface of a plinth or on a re-education board. So the whole leg should be supported on the bed, and we should ask the patient to do hip abduction and adduction. So while this, you should give the commands to the patient in their own language, that you have to take a leg out and again bring it inside. So this was the first, that is line. Now there is one second exercise in line. Same, you have to follow head rest, one hip and knee flexion and extension. Okay. So here what we are going to do together, both the joints you are taking in the action. That is what your hip and knee. Okay. So hip and knee flexion and extension. So how you will do? If patient is in supine position, sleeping supportively, head is being raised, and you have to just ask to flex the hip and knee together. The heel is supported throughout. So this is very important. The exercise should not be open chain exercise. It should be closed chain exercise. So what is this closed chain? Means the distal joint has been fixed to the plinth or any of the supporting surface. So the heel is supported throughout and slides on the plinth to position indicated by the physiotherapist. So you have to just drag your heel. Okay. So ultimately what will happen? Your knee and the hip together, it will go into the flexion, and again you have to take it down. Now third exercise, again it's in line. There is one leg raising to place heel on specified mark. The mark may be made on the plinth, on the patient's other foot or shin, or the heel may be placed in the palm of the physiotherapist's hand. Okay. So here what you are going to do is, you should lie down and ask the patient to just touch the heel to the shin of the leg. Okay, you have to take it down, or some mark you have to do it on the bed or on the floor, and you have to touch it. Next is the line. In line, that is head raised, hip and knee flexion and extension, abduction and adduction. The legs may work alternately or in opposition to each other. Stopping and starting during the course of the movement may be introduced to increase the control required to perform any of these exercises. Then next we'll see for the sitting. So this is what sitting, one leg stretching to slide into the position indicated by the mark on the floor. Whatever we have done in spine, that is in sleeping. You can do it in sitting also. So in sitting you have to draw a circle or a certain point on the floor, and we have to just ask the patient to take the finger on that circle or to touch the point wherever you have drawn. So next is sitting alternate leg stretching and lifting to place the heel or toe to the specified mark straight sitting. Okay, so change to the standing and then sit down again. So these are the various steps you have to do. You have to stand again, you have to go into this straight sitting, again you have to touch to the specific mark, again you have to stand up. So this is what the exercise pattern which you have to follow. The feet are drawn back and the trunk inclined forwards from the hips to get the center of gravity over the base. The patient then extends the leg and draws himself up with the help of his hands grasping the wall bars or the other suitable apparatus. So here you can even keep some objects in front of the patient and you can just ask to, you have to lean forward and you have to grasp that object. This is a very easy or a simple thing what I am talking, but it goes very difficult for a patient to perform. Okay, so these are the exercises in line. Now we'll see what are the exercises for the legs in standing. The first is your straight standing. Transfer of weight from foot to foot. So showing walking sideways, pressing foot on the marks. So these are what all your foot exercises. So where in those patients where balance is not much more hampered, you can go these Frenkel exercises for the patients in standing. So you have to put some marks and you have to ask to walk on that mark, or you have to draw a circle and again you have to go round to that circle. Group work is of great value as control improves and it teaches the toe on the patient to concentrate on his own efforts without being distracted by those of the people. The ability to climb stairs and to step on off a curb helps him to independence. So you can either ask them to climb the steps. Again, you have how much is possible for the patient you can ask, and again you can ask to come down. So for the upper limb there are some shoulder flexion extension exercises to place the hand on a specified mark. Then one arm stretching to thread it through a small rope or ring, sitting, picking up objects and putting them down on a specific marks. You have to pick it up and again you have to put it on the other place. So these are all your upper limb exercises or in the standing exercises. So now this is the next part. So now up till now we have studied the Frenkel's exercises. What are the principles of Frenkel's exercises? There are main three principles we have studied. That is your precision, attention. Okay, and next we have studied what are the techniques, and then after that we have studied what are the procedures or what are the exercises. That is also in standing and in lying and in sitting. Okay, so up till now everyone got it. Now we'll go or switch on to the next chapter, that is the balance. So why balance has been included in neuromuscular coordination? Because if neuromuscular coordination has been hampered, even the patient's balance has been affected. So we'll have a short talk on this. So what is balance? It refers to an individual's ability to maintain their line of gravity within the base of support. Okay. So what is the line of gravity? What is line of gravity? So it is the line which passes from the base of support. It can also be described as the ability to maintain equilibrium, where equilibrium can be defined as any condition in which all acting forces are cancelled by each other, resulting in a stable balanced system. Okay. So even this balance you can call it as postural control, postural stability or equilibrium. So there are other three names for the balance. Now there are main three systems. Okay. So the following systems provides input regarding the body's equilibrium and thus maintains the balance. So the first system is your somatosensory or proprioceptive system, second is your vestibular system, and third is your visual system. So all these systems should be intact. If anything is being hampered, your balance will also get hampered. So the central nervous system receives the feedback about the body orientation from these three main sensory systems and integrates this sensory feedback and subsequently generates a corrective stabilizing torque by selectively activating the muscle. Okay, so there should be a proper work in between all these three systems. Okay, these three systems should work in conjunction to have a proper balance. If any of these three has been hampered, the patient will show imbalance. In normal conditions, healthy subjects really 70% on somatosensory information, 20% of vestibular and 10% of vision on the form surface, but changes to 60% to the vestibular information, 30 to vision and 10 to somatosensory system. Now we'll see what are the how is the balance classified. So there are main two types of balance. First is your static and second is your dynamic balance. So what is static and what is dynamic? Static means what which is not moving at all. It has been stagnant at one place. So how you will define it? It is the ability to maintain the body in some fixed posture. Okay, nothing has been moving in this. Okay, it is the ability to maintain the postural stability and orientation with center of mass over the base of support and body at the rest. Next we'll see what is dynamic balance. Dynamic balance means what? Now I am walking. Okay, so walking means I am along with the walking I am maintaining my balance. So dynamic means moving. It has been defined as postural stability is more and challenging. It is the ability to transfer the vertical projection of the center of gravity around the supporting base of support. And it is the ability to maintain postural stability and orientation with center of mass over the base of support while the body parts are in motion. So this is very important when the body parts are in motion. So this is what the how is the classification of the balance. Now we'll see for the balance test. Okay, so what are the balance tests and what tests you are going to perform in the patient. So balance test of this kind are of patients with coordination problems, involuntary body movements, dizziness. So these are some examples where you have to perform these balance tests. So upright and can help determining the gait index, which is the likelihood of someone falling. So the gait index is especially important in US where fall deaths have been onto the increased side. Now see there's one test called as Romberg's test. Okay, so this is the test to perform or to check the balance. So how it is being performed? The patient is asked to remove his shoes and stand with his 2 feet together, and the arms are held next to the body or crossed in front of the body. And the clinicians ask the patient to first stand quietly with eyes open and subsequently with the eyes closed. Okay, so this is what you have to stand like this, or you have to just hold your both the hands ahead, and initially the eyes you should open the eyes. You have to see the balance of the patient. The patient tries to maintain his balance. For safety, it is essential that the observer stands close to the patient. If the balance is been hampered, what is your role? The therapist has to stand near to the patient so that the patient should not sway or fall down. Okay. When the patient closes his eyes, he should not orient himself by light, sense or sound, as this could influence the test and it results in the cause of a false positive outcome. So whenever you are closing the eyes, what is the important thing you have to see is patient should not orient himself for the main 3 things, that is the light, sense and the sound. Okay, and you have to see for the faults or the sway of the patient. If it has been found, then this Romberg's test has been positive. So it is 4 by counting the seconds the patient is able to stand with the eyes closed. How much second patient is able to stand with the eyes closed? So that is it's been calculated, and according to that scoring has been done. The literature does not report alternative methods for scoring. Okay, to make this test more difficult, clinicians can attempt to distribute the patient's balance with the perturbations. So suppose what is that? First, you will ask the patient to stand with the eyes open, then with the eyes closed. And if this has been performed properly by the patient, then you have to give some perturbations to the patient. So like you have to give some distractions in such a way that the balance, this task goes more difficult for the patient to perform. A Romberg's test can also be used for follow-up assessment for the patients with balance and or impairments by comparing several different assessments with each other. If the clinician observes that the patient is able to stand for a longer period of time with the eyes closed, it is evident that the patient's balance and proprioceptive deficits have decreased. Okay. So ultimately, if the patient is able to stand with the eyes closed for a longer period of time, so what has been, whatever deficits are present, the proprioceptives or whatever balance, that has been decreased. This test is positive when the patient is unable to maintain balance with their eyes closed. Losing balance can be defined as increased body sway, okay, placing one foot in the direction of the fall or even falling. Now this is the next, that is your sharpened or tandem rhombus test. This is the progression of the initial rhombus test what we studied. So here it is a variation of original test. The implementation is mostly the same. Okay. For this second test, the patient has to place his foot in heel to toe position. So like what you will do is your heel and toe should be placed like this. Okay, like this. And then you have to see for the balance of the patient. As with the original rhombus test, assessment is performed first with eyes open and then you have to see with the eyes closed. Only here the fits are being placed in front of each other. Okay, initially the patient was standing properly. The patient crosses his arms over his chest and the open palm of the hand lies on the opposite shoulder. The patient also distributes his weight over both his hips and hold his chin parallel with the floor. So again what you have to do, you have to place your one hand on the shoulder. And how will be the leg position? You have to stand in tandem walking like this. And you have to see for the balance. Okay. This position, how much time or how much seconds the patient is able to maintain this position. Initially with the eyes open and then with the eyes closed. So this is what you have to perform. Obese and older individuals may be unable to stand in this position for a prolonged period of time. For these populations, the rhombus test does not exclusively demonstrate proprioceptive impairments in comparison to the other confounding factors. If many of the patients are obese, okay, so what happens? This test becomes difficult for them. So this is a diagram where you can see just now we have discussed. So initially the first rhombus test was fit together. This is the semi-tandem position and here is the tandem position. So you have to progress it like this. First you have to, in this there will be the patient will be able to maintain the balance more easily. This task becomes, the second task becomes difficult and this task becomes more difficult. So first is with the eyes open and then with the eyes closed. Okay, so apart from this rhombus test, there are other 4 tests to check the balance. First is the stand with your feet side by side. Okay, so like what you will do is just you have to place one foot to the other. Place the instep of one foot so it is touching the big toe of the other foot. Then tandem stands place. So this is your second. Third is your tandem stand place. One foot in front of the other, heel touching toes. And fourth is your stand on one foot. So like what you have to just lift your one leg like this and you have to stand on one foot or on the one leg. So these are the 4 other tests apart from the rhombus test. Okay, so now we'll go for the last part, that is the balance exercise. So you have to first go into the exercises. First you have to check, you have to do all these tests and according to the scores you have to decide which exercise is comfortable for the patient. So these are the exercises which are prescribed by a physiotherapist to challenge your balance in order to improve it. It will challenge the body's vestibular system and the musculoskeletal system. So these 2 systems are involved in balance exercises. They aim to improve the body's ability to maintain the posture and center of gravity. So what is the aim of this balance exercise? Why it is important? So what will happen? This will improve it will maintain the posture and improve the center of gravity. Now next is, what are the exercises we'll see? Okay, in almost every balance exercise, patients, there are many variations in these exercises to be given to improve the balance. Okay, so the first here is the single leg stance. So what instructions you will give? Start with your foot at hip width. While holding onto a counter, lift one foot off the ground slightly and keep your body your plantar foot. Advance of these exercises by transitioning to one hand support and eventually no hand support. It's always good to perform near a steady counter in case you need to quickly attach your balance. Hold your foot up to 10 to 15 seconds and repeat 5 times on each leg. Okay. Why is this is important? You stand on one leg every time you take a step or walk up and downstairs. Don't underestimate the importance of single leg stance exercise. Second is the foot taps to step or hold. So what instructions you will give? Stand tall, facing a step or hold. Beginner should use support from a counter or handrail until the balance gets improved. So for this 10 repetitions you have to give for one leg and you have to repeat it for 2 to 3 times. Now this is important. Why it is important? Because it improves the coordination for ascending and descending stairs. After strengthening your coordination with this exercise, you won't catch yourself tripping on a step anymore. As this is the third is your narrow stand bridges. So here what you have to do, begin with your feet together or as close together as possible while still feeling stable, and you have to stand tall and reach forward with one hand while holding onto a counter or solid surface for the safety. Similarly, again you have to perform for the 10 bridges with each arm and you have to repeat it for 2 to 3 times. This is important. Why? Because many falls occur while reaching for an item in a tight space. This exercise strengthens your balance. This is the third is the way hip kick. So stand with your feet shoulder width apart and while holding onto a counter or a firm surface, extend your leg forward and return to your starting position. Repeat this motion to the side and returning to starting position. Finally, extend your leg back and return it to the again starting position. So this process you have to repeat it. Okay? And you have to do it for 5 to 10 times for one leg and again repeat it to the other leg for 2 to 3 times. Why way hip kick? The name of this exercise is way hip kick. So it also strengthens your hip muscles also, and it maintains the stability during your walking, turning, and going up and down to the steps. Now, fifth exercise is standing marches. So what you will do here is stand with your feet shoulder width apart while holding into a counter and raise one leg in a marching motion and alternately. So like you have to do marching like this. Okay. So this is what you have to perform. According to what initially you have to do for 20 marches, 10 on each leg, and then again you have to repeat it 2 to 3 times. So this mainly improves what? Your hip strength, single leg balance. Okay. Now next is your mini lunges exercise. So here what we will do, stand with your feet shoulder width apart and you have to step forward and bend your front knee slightly. Return to your starting position and repeat with the opposite leg. This also you have to perform for 10 repetitions on each leg. Again you repeat it for 2 to 3 times. So the importance of this exercise is it mainly strengthens the legs while stimulating forward step in motion. And it sometimes stumble forwards. These exercises will help you to practice catching yourself before you actually fall. Next is your lateral stepping. So here what you will do, standing with your feet apart together while holding into a counter, step to side so your feet are just past shoulder width. Continue this motion along a counter, performing 5 to 10 steps on each side. This you have to perform for again 5 to 10 steps and you should repeat it for 2 to 3 times. So this mainly in older adults, the fall due to poor coordination and when turning and stepping in tight spaces, this exercise helps to improve coordination for many turns and side steps you take throughout the day. This is your tandem or semi-tandem stance. Stand with one foot in front of the other, so you are in a heel-toe position. If this is too difficult, initially move feet apart as last for the diagram what we have discussed. That is what the feet together, semi-tandem and tandem position. Same is the exercise being carried out here. So that you have to go into those positions and you have to maintain this for 10 seconds and again repeat it for 2 to 3 times. while holding onto a counter, same. And again, what you have to give, one stepper you have to give, and you have to place one heel on the stepper, okay, and this position you have to carry. Do it for 10 repetitions and again repeat it for 2 to 3 times. 11th is your hamstring stretch. So this is, you can do it in standing or sitting. Stand with your leg on a step or ground slightly in front of your body. Keep your back straight and gently lean forward, feeling the stretch in the back of the thigh and knee. So in standing you have to just bend like this. So this will stretch your hamstring muscles. So this you have to do. Another way to stretch the hamstring is to sit and extend your leg. So in long sitting position also you can ask to touch the toes of the foot. Okay. So that will stretch your hamstrings. Hold the stretch for 10 to 20 seconds and repeat it 2 to 3 times for the both the legs. So what is the use of this exercise? It will make your hamstring muscles more flexible. So where are the hamstring muscles? It is been located at the back of the thigh. So what is the action of the hamstring muscles? It flexes your knee. So in those patients or in some of the balance hampered patients, there is tightness of hamstring also, and along with that it is very difficult to do this movement. Okay, so this also maintaining balance in leaning position is also difficult. So for that we have to give this hamstring stretch exercise. It will mainly relieve you from it will give you flexibility and decrease the cramping, spasm upon the standing positions. As we have done hamstring, the last is your calf stretch. So how you do calf stretch? Stand with your foot against a step and gently lean forward while holding into a railing or a countertop. You should feel a gentle pull in your calf or ankle as you hold it for 10 to 20 seconds. Okay, so you can just do ankle to movements like this in long sitting or in standing. You can just lift your heels off the ground. Okay, so that will stretch your calf. Again, you have to hold the stretch. Holding the stretch is important for 10 to 20 seconds and again repeat it for 2 to 3 times. So today we have discussed the 12 balance exercises. Okay, there were certain Frenkel's exercises. Now will anyone is having any doubt? Everyone are getting? So now we'll see for the conclusion. Okay, what is the whole summary or the conclusion of the topic? So developing neuromuscular coordination is important and often overlooked factor in long-term success in sports as well as to increase power, endurance and skill-based activity. In power of or strength-based sports, it allows for a greater ability to exert a force or to exert that more efficiently. So why it is important? Neuromuscular coordination. Okay, so it is important it is even helpful in sports athletes, okay, or in the patients to improve on power, endurance and skill-based activity. Okay, so there are various conditions where neuromuscular coordination is being affected. Those patients who are having incoordination. So in such patients today, what we saw, what are the Frenkel's exercises, what are the balance exercises, what are the special tests to assist balance. Okay, so these are the main two types of exercises what we have studied today. And you can just proceed it and practically you have to do it in the patients. So you will come to know how it has been performed and what difficulties you have been seen in the